Hello everybody, my name is Andreas from CatchLife and today we are here with Dr. Murat.
Hi. Hi
So,
everybody.
how are you today?
Thank you. What about you?
I'm good, thank you about. So, I just wanted to tell all of you guys, so on 11th of October we are in Bristol and on the 12th of October we will be in Birmingham with Dr. Murat Tüzüner.
Yeah, I will be there
Yeah.
for your questions, for your examinations.
Exactly, so we're gonna do face-to-face meetings with all of you. So if you want also ask your aesthetic questions to the surgeon face-to-face, you can come to us. And if you want to join these meetings, you just have to text us on WhatsApp or you can text us on Instagram for a booking.
Yeah.
And then we will help you with that.
Yes, we are waiting you.
So yeah, see you on the 11th and 12th of October. So yeah, how was your day by now?
Thank you.
So had quite rough day or was it really busy?
Busy.
Yeah, quite busy, I guess so. Okay, so I will start with the first questions. So the first question that came, we got actually one online right now.
Yeah, exactly.
So the first question is, do you do closed rhinoplasty?
Yeah, I do closed rhinoplasty, but I don't prefer too much because I don't think that there is mainly difference with closed and open one because the scar healed invisible. Because of that, opening all area for total leakage is better than the closed, I think. But some ways, if we do a minimal on tip or something's minimal, sometimes we can use closed rhinoplasty.
Okay, but mostly you prefer the normal open
mostly
rhinoplasty?
prefer open one.
Okay.
Because I don't think that the scar will be visible and none of my patients complained about it.
Yeah, same. We never had complaints about any scars, so open rhinoplasty is the most preferred way. So we can continue with the second question actually, and that is when a patient says that he or she wants a natural look, what does it mean to you as a surgeon? How do you define that?
Yeah. The natural mean is not aesthetic. Aesthetic not mean natural. I think they mean this. Natural aesthetic. Natural aesthetic means that something is natural and aesthetic.
Okay.
They mean with this question not to seen as fake. It's mean I don't want to look fake. It's mean I want to look natural.
But is that possible for a patient?
Exactly.
Okay.
Because we talk during the examination about what kind of leakage they want. Then we alert if they want aggressive things and fake things. We always alert, and if you know what they want, then we do that.
Okay, perfect. So natural is definitely possible, but as he says, it doesn't mean aesthetics.
Yeah.
So that's up to the patient actually.
Exactly.
Okay. So the next question would be, how do you balance the function of aesthetics when a patient is primarily focused on the appearance?
Yes. In aesthetic surgery, it's a mainly question. If the person have a functional problem and also aesthetic problem, we always ask, which is more important for you? If the patient says the aesthetic one, we primarily try to correct the aesthetical, but it's not mean that we don't correct the function. Also we correct it, but the primary we do the appearance.
Okay, so primary goal would be aesthetics.
Exactly.
But if it goes to function, you will focus on fixing the bone or perfect.
If the patient says the breathing function is more important for me, then we say this is not an aesthetic operation. This is a functional, a reconstructive operation. Then we evaluate another way.
Okay.
Not aesthetic.
Okay, that's good to know. And how is it? Do you believe in non-surgical rhinoplasty, such as fillers? Is it a good alternative?
We can compare with the surgery.
Okay.
Because the non-surgical ones, we never compare with the surgery. It's exactly temporary. Because of that, but it's useful. Because it's not mean that I don't want rhinoplasty, then we can do filler. No. We suggest some patients, you don't need exactly rhinoplasty. We can do a little effects with fillers. When we do that, the patient gets very happy.
Okay.
And we say, you have to do every 6 months, maybe every year. And the patient say, yes, okay, I can do. and we can go with that way.
So-
and when patient says, I like this leakage,
Yeah.
can you do that leakage with rhinoplasty? Then I say yes, then we do the operation.
That's good that you mentioned that. I just wanted to ask, like, let's say a person is afraid of surgery,
Exactly.
so they can see like what it will be with
Exactly.
normal rhinoplasty, and then
Yes, some
Okay.
patients say that I don't want surgery, I'm very scared about it. Then, but I want to see how will be my nose. Then I suggest first a filler.
okay,
After the filler, patient says yes, I want that operation. Then we can do it.
okay, that's actually a really good
Exactly.
thing for patients
Yeah.
who are really scared.
Very
So
good way. Very
if you're
good way.
really scared, you can start with fillers and then get a rhinoplasty
Exactly.
afterwards. And who is an ideal candidate for rhinoplasty?
Yeah.
Is there a special role or?
We have to think like that. We have to think the nose on the face with the other part of face.
Mhm.
Because of that, if the nose shape is not good, we exactly always suggest rhinoplasty. But sometimes the shape of the nose is suitable with that kind of other face parts. On that situation, sometimes we don't suggest.
Okay.
Because the nose shape is not good, but according to face, the nose looks good. On that way, we don't suggest. Sometimes some nose has a characteristic leakage. Then we don't want to apply rhinoplasty on that nose, because
Okay.
when we apply that, all the phases changes,
So
and the person don't want it.
it goes back to the question when it comes to the natural or aesthetic look.
Exactly.
So when the person says he wants it natural, but it's
Exactly.
not possible anymore,
Exactly.
you can't do it.
Yes.
Okay, perfect. And how long does the recovery take usually?
It can change person to person, but I can say the patient starts to feel normally after 3 weeks.
Okay. And
But the healing period goes up to 1 year
okay.
as a biological. But as a leakage, 3 months maybe. In 3 months, patients saw the step by step how it's feeling. After 3 months, it stopped. You can't see anything change. But as a biological,
Yeah.
for things like that, getting strong tissues, it goes up to 1 year.
Okay.
But
But for the
we can
looking
say
and
it's
for the
3 weeks,
feeling,
yeah.
it's like 3 weeks.
Exactly.
Okay, so-
After 3 weeks, the patient goes front of the mirror. Yes, it's okay. I want this, and it goes.
Okay,
like
and they can normally go to work
Exactly.
again as they used to be.
Exactly.
Okay. So it's a really short time of recovery actually then.
Yeah.
That's great. And how does it come when a patient decides, or how do you decide if it needs an open or closed rhinoplasty?
There is no exact rules.
Mm-hmm.
I usually prefer open one, but if the patient says I want it closed, I say some areas restricted for us. For
Yeah.
example, if the person have a very complex nose, dorsal nose, if
Mhm.
I have to work on these areas too much, I say I can't do closed.
Okay.
Because on the closed, I can see on the tip of the nose. I can work on the tip of the nose only. I can't work on septum, on deep layers, or on the bone too much.
Okay, so
If
it
the-
would be too difficult.
Too difficult, and what it's caused allowing the operation time,
Mhm.
and the complication rate is get more higher on that
Mm.
situation. Because of that, opening it better than the closed.
Okay, so open means it's safer for you and the patient at the same time? Okay.
If it's complex. But
Okay.
if we do as simple things on only tip area, we can do closed.
Okay, so then it's not an issue really.
Exactly.
Okay, perfect.
We decide according to the examination and what patient want.
Okay, so we got one more question from our
Yeah.
patients, and that is, are the scars visible after the surgery? We already got to
Never.
that point, but
No,
never really.
no.
So is it
I
like,
never see any hypertrophic scar on nose surgery.
okay, so it's really like hidden, you don't really see it?
Yeah.
Okay, so no scars after the surgery, that's actually a good thing. Because even after a face and neck lift, you will see a tiny bit if you look close, but on a,
That scar about the tightening,
yeah,
because we lifting the
Yeah.
skin, and there is a vectors, the
Exactly.
power vectors. Because of that, it gets enlarged a little bit. But on this area, never power of strain. Because of that, the scars get increased.
that's why it's
There
healing
was-
way faster and
Exactly.
better? Okay. And how is it with the stitches? Are there any stitches made? Are they dissolvable?
It can change.
Mm-hmm.
It can change. Sometimes we put resorbable ones, but resorbable ones not drops itself at its time.
Okay.
Because of that, I usually use stitches that we have to take off,
Mm-hmm.
especially on skin area. Inside we use all absorbable ones. By the time it will get to drop itself.
Okay.
But inside ones or non-absorbable ones for long standing, we use non-absorbable ones inside on cartilage.
Mm-hmm.
For shaping the cartilage, we use non-absorbable ones inside, but outside on the skin and the mucosa, inside the nose, we use absorbable ones. On the skin, non-absorbable ones. Sometimes absorbable ones. It can change. It's not important.
Mm-hmm. So it changes from patient to patient. What is needed and what is not needed. Okay. And what should the patient avoid before and after surgery?
There is no exact rules. Before the surgery, it's the same with the general surgeries. Not blood thinners.
Okay.
Don't smoke.
Yeah.
The general things. There is
The
no
classic
specific
stuff.
things. Yeah. There is
Yeah.
After the surgery, it's enough protecting the nose up to 3 months is enough.
Okay. And for how long they
Think
should
like that.
smoke?
Think like that. We don't suggest using any device on face.
Yeah.
For example, diving mask or another kind of mask for doing any kind of sport. We don't suggest up to 6 months.
Up to 6 months.
Yes. After,
Okay.
for example, sunglasses, we never suggest up to 3 months, sometimes 6 months. Because on these areas, the healing goes up to 1 year, especially on bone. For getting strong bone, we need 1 year.
Okay.
Because
So before surgery, it's easy. No smoking, no blood thinners.
It's enough.
And when it comes after that, 3 months, no glasses. And up to 6 months, no masks for any kind of sport.
Exactly.
So that would be it. Okay. And I think don't getting punched. So get away from any kind of fights.
Yeah. And don't live in a crowded areas.
Yeah. So the next question is, should I use a retainer after rhinoplasty? What is a retainer?
Retainer is, I don't think that it's a rule. Sometimes we apply a nostril for making smaller nostril. We cut outside of the nostril and we have a contracted nostril. Sometimes for not more contraction after the operation, we use retainer, silicone retainers, up to 3 months, sometimes 1 month. I don't use it usually.
Okay, so mostly no retainers for your patients?
It's not a rule.
Okay.
I don't suggest
okay, so
on every case.
So that's something that depends from surgeon to surgeon, I guess.
If we do a specific issues on the tip, for example, sometimes we use cartilage grafts. We are taking a graft from another part of body or inside the nose. We take in cartilage part and we support. We do a framework, very specific framework for protecting it. Sometimes after the surgery, we can put retainers for supporting the area up to healing.
Okay, perfect. So the other question would be, what's the most important thing that patients should communicate with you and also with us before the surgery?
We ask because they are going to get a surgery. We are the general questions. Did you get a surgery before? Did you have any blooding problems? Do you have any breathing problems? Because patients sometimes don't say the breathing problems. During the operation, I'm seeing there's an obstructed airway.
Oh, okay.
It's very important.
Yeah.
The most important question is this: the medical conditions, using any drugs, did get any operation, and some patients don't say they get a nose operation before. It's very important.
Okay.
Because it's changed all the plan during the operation.
Okay, I get it. Because
yes, when we open, if we need cartilage, I have to take a cartilage from other part of the body, and we have to talk before the surgery.
Yeah, there's nothing you can decide while the patient is asleep already.
Maybe the most important question is that: did you get any surgery before the surgery with your nose?
or
It's
not.
very important.
Yeah. So the whole medical history is an important
Exactly.
in that case, and always be transparent.
Yeah.
So the surgeon never judges you.
Yeah, exactly.
So it's just important for especially the anesthesia, I guess, that everything is going smooth.
Because it will affect the result.
So always be honest, be transparent, and the surgery will be fine. I guess
Exactly.
so. Yeah.
Every time.
Every time. Okay, so after that, if someone brings a celebrity picture to you,
Yeah.
how realistic is it
We
to get that one, to get that result?
we see this condition many times. We can't say it's copying, but it gives us an idea what they want. I'm making that shape, and I examine the patient's face. Then I say it's suitable for her, for him, or not. It's sometimes is a point of starting what they want.
Okay.
It's good. I like that. It's a good patient, I think, because they are bringing some things that want to be, and it's a real one.
So it shows you the expectation, so you can...
It's a real one. We can talk on
exactly.
it. I like that kind of patients. But I'm explaining it will be suitable for that face or not. If yes, I'm going to do exactly like this.
So it's possible
But,
also to
it's
do
possible.
it. Yeah.
For example, a patient's skin is very thick, for example. But the celebrity's photo skin is very thin.
Yeah, I know.
Primer, I say, I can do that cartilage framework, but I can't make thinner and thinner as is your skin. What it means, also I did the same framework, we can see the same effect.
So let's say I don't
Because
have
of that-
any issue with my nose, it's just a shape, and I tell you I want it like this. If it's suitable for me, it's possible.
Exactly.
Okay.
It's all about the patient's specifications
Yeah.
and the celebrity's specifications.
Okay, so...
If it may match, we can do almost the same.
Okay. So we will recommend it to the patients to check some noses before, and then at least have an expectation.
It's not have to be a celebrity. Any nose photos is enough for us.
That you like.
Yeah.
Okay. And what roles does skin thickness play in rhinoplasty?
Yeah,
Is it a big role?
I said, it's a big role, especially on male patient. It's a problem because lots of male have a thick skin.
Yeah.
We have some ways to making skin more thinner, but I don't think that it's so effective because it's by the time gets thicker again. We use some medical treatment before the surgery, making skin. It's the medication of acne and dermatologic. We use that kind of medicines for making thicker. But I don't like it because it affects healing period, and after a few months it gets thicker again.
Okay.
Because of that, with the thick skin, we exactly talk what we can do. It affects the results, but we can, for example, we can use more supporting cartilage on thick skins because it's heavy. Because of its heavy, it can change by the time because of the gravity. Because of that, yes, it affects us the skin thickness.
Okay, but there is still a solution actually.
Exactly.
Okay.
But
So
the problem is this: if the very thick skin wants very thin skin's results, we have to talk. We can't obtain totally that leakage.
Okay, so but there's a solution in general.
Exactly.
So even if I have
we can do the
thick skin-
similar. We can do the similar.
Okay.
Yeah.
Okay. And what is it with? What is the difference between the tiplasty and the normal rhinoplasty that we know?
Yeah, the main risk is that tiplasty is only working on the top of the nose. These areas only.
Okay.
Rhinoplasty means this area's cartilage, the upper level cartilage, the bone, and inside the nose there is a septum separating two breathing airway. The septum is where you go to deep areas.
Okay.
The rhinoplasty mean that.
Okay. So the tiplasty is just really this tip, and it's easier. I think?
Simple one, yeah. Easy
Simple one.
Yeah.
Okay.
Sometimes we can do in under local anesthesia.
Okay. And the next one will be secondary rhinoplasties. Different.
Yeah.
It's different from the first time, like the revision of it.
Yeah. The way is almost same. We are opening it, but when we open it, we examine what we have on the second level.
Okay.
Because we can't know. Sometimes if we during the examination, if we see something measure, we get tomography, computer tomography imaging for looking what we have. Because if we don't have any tissues for reconstruction, because think like that, if when I open a primary rhinoplasty, I harm all cartilage, because all cartilage gets off and I can't use them.
Okay.
I can't use the cartilage again. I have to open it by separating. Then I can't use it and I need cartilage. Because of that, we are using rib cartilage, then auricle cartilage. Because of that, the opening way is same, but the operation is different.
Okay.
It's not a rhinoplasty, it's reconstructive rhinoplasty.
Okay.
Reconstructive means we have to do a new tissues there. We don't use the tissues.
So there's always like a needed fixing to be.
Exactly.
Okay, and does it take longer for the surgery itself, or how long is that surgery, for example? Usually?
Usually 3.5, sometimes 4 hours to secondary rhinoplasty.
So
if we need getting cartilage on it.
And comparing to a normal rhinoplasty is about 2 hours?
Yeah, 2.5.
2.5, so it's
maybe
one and a half more work.
Yeah, more.
Okay, and how's the healing after it? Is it the same or?
Almost same, maybe 1 week
difference,
maybe.
Okay, so if a normal rhinoplasty usually takes 3 weeks?
1 month we can see it.
It's 1 month for the reconstruction. Okay. Okay, so we got that one. Here's one more, and it says, can a rhinoplasty be safely combined with any other procedures?
Exactly.
Like chin augmentation, eyelid surgery,
all kind of
breast,
all kind of.
The
important thing is sequence of the operations with the combining. The professional thing is that, because firstly I always do the rhinoplasty if I have to do some things, because if I make any other area, especially on a bone, the swelling affect the leakage of the nose before the surgery. Firstly, I'm doing the rhinoplasty, then I'm making the augmentations.
Okay, so the first focus is the rhinoplasty.
Yeah.
Okay,
we can combine with the other kind of face operations.
Okay, perfect. That's good. And can a rhinoplasty and functional surgeries like septoplasty be performed together?
Yeah.
So
we usually suggest it.
Okay.
If the persons have a breathing problem and have a septum deviation on the same operation, because we are opening the septum, we are using the cartilage from the septum. During that time, also we correct the deviation from the septum. If the cause is deviation, if the cause is the concha, we say concha of the nose, then we resect the conchas inside or make conchas more smaller during the operation. We usually combine it.
And how is it with a patient, like, just for an example, me, I for example really like my nose, but I have a deviation to the left. What would you suggest for me? What would it be, an open or closed septoplasty? And can it be fixed without changing the
It's all about your
shape?
Examination. We will examine you. I'm going to examine your breathing ways. If you really have a breathing problem, because sometimes although you have a septum deviation, it don't get a problem during. Firstly, we are looking at that. Then we get an CT imaging, computer tomography imaging. Then we will see what kind of deviation you have. According to that, we will decide, can we do it closed or not. If it's more deviated, I will open it. If minimal deviated, I can do with the closed one.
Okay, that's really good actually.
Yeah.
So I will have a think about that. Okay, so that was it for the questions for now. So if you have any questions, you can ask it now or also later. When we are offline, you can always send us your question on WhatsApp, on Instagram.
Every time.
I just want to remember you guys. So at the 11th of October, we are in Bristol with the surgeon, with Dr. Murat. And
we will be there.
Yeah, same as for the 12th of October in Birmingham. So if you have any questions, you can ask them always on WhatsApp or Instagram, or you can leave them for later, get an appointment from us.
Face-to-face.
Join the face-to-face meeting to ask the questions directly to the surgeon. And yeah, so thank you for being here, for answering all the questions. Also thank all of you for all the questions. Really amazing. Thank you for the feedback. And yeah, thank you very much.
Okay, thank you.
See you next time.
Thank you.